Hi, well, welcome everyone. We're super excited to have you here tonight. Thanks for taking some time out of your Wednesday evening. We're going to be going over a great Medicare presentation today. I'm going to announce our presenter in a little bit, but before I do that, this presentation today is going to be Medicare benefits A to Z. So we're privileged to have Bob Bernardo of Medicare Benefit Advisors, and he's got a tremendous amount of experience learning about Medicare and helping clients with Medicare, and he's been doing it for a very long time. So we're super thrilled to have him, and we know you're going to get a lot out of today's presentation. Before we get into it, a couple housekeeping items. First and foremost, this is being recorded. So in a couple days, maybe a week or so, our team will get this up on our website as well as our YouTube channel, and we'll be happy to send you the link if you can't stay for the full time. But this will be recorded. Another thing, also, we're going to have time at the end for questions. Feel free to put any questions you have in the chat, and then Bob's going to do his best to make sure he spends some time at the end to answer any questions you have. But we definitely want to make sure you get all your questions answered and get a lot out of today's presentation. So feel free to ask your questions. We'll probably reserve them at the end, but with that and the fact that it's being recorded, those are kind of the two primary housekeeping items. So I'm privileged to introduce our presenter, Bob Bernardo of Medicare Benefit Advisors. As I alluded to, he's been doing Medicare for a very long time and knows the ins and outs of the system. So he's going to fill you in on a lot of great things related to it, what you need to know, how to avoid costly mistakes, all the different parts. So I'm going to pass it over to him shortly here to kick it off. But before we do that, can everyone hear me okay? And Bob, you want to say hello? Could everyone hear Bob okay?
Hello, hello. I'm here.
Give a thumbs up if you can hear us. Okay, great. You can hear us okay? Perfect. Great. Awesome. So I'll go ahead and kick it off to Bob. Take it away.
I got it. Thank you so much. And hello, everybody. Thank you very much for attending tonight. And I thought I'd give you a little quick snapshot of my background and what I'm doing. I've been selling Medicare insurance only for the last 9 years and started in Orange County. And I actually lived in Orange County for 45 years. And about 4 years ago, my wife and I packed up and moved over to Las Vegas. But we both still do most of our business in California. I'm also licensed in about 13 states, and I have about that many companies that I'm under contract with. Most of the big ones that you've heard of and know of, and some of the smaller ones like Scan Health Plan over in Long Beach. So what I thought we would do is we'll run through about 18 PowerPoint slides, and it goes into some pretty good depth about Medicare. So make a lot of notes. If you have questions, just jot them down or pop them in the chat, and we'll go over that towards the end. So we're going to go through this agenda, and hopefully it's not too basic for those of you who have done some due diligence on Medicare. But we'll touch on the top three mistakes just right off the bat, and then we'll just go down the list and get through the slides. So here we go. So starting with the top three Medicare mistakes, the first one is only signing up for Medicare Part A and B. And this happens quite often when people enroll in Social Security before age 65, and that happened a lot during COVID. And when you approach age 65, Social Security will automatically enroll you in Medicare Part A and B. And what most people don't realize is A and B by itself has no out-of-pocket limit. It's uncapped whatsoever. So if you go into the hospital and you run up a big hospital bill, you're responsible for 20% of every bill until it's paid off. And the way to avoid that is you can enroll when you're eligible in one of three options, and that's a Medicare Advantage HMO or a PPO or a Medigap plan. And we're gonna go into detail on all three of these options. So that's mistake number one. Mistake number two is probably even more common when people delay Medicare. You don't have to sign up for it at age 65, only if you have an active group health insurance plan from a company, an employer, and it has at least 20 employees. If you happen to work for a company that has less than 20 employees, 19 or less, then you have to sign up for Medicare at age 65 because the company's not obligated to provide insurance after age 65 with a small company. So if you look at these 5 insurances on the slide here, the COBRA retirement coverage, VA coverage, former employer coverage, and Obamacare or ACA, Affordable Care Act, none of that counts as creditable coverage. So the mistake that a lot of people make is they retire at 65 or whatever age, and they get the union health plan or they get the company retirement plan, and they stay on that for they might get COBRA for 18 months, and then they finally get around to enrolling in Medicare, and then they're staring at lifetime late penalties because they didn't enroll in time and they did not have what Medicare calls creditable coverage. So the way to get around that is you consult with an agent like myself to make sure that your coverage that you have is creditable. As long as it's not one of these 5 types of insurance, you're okay to delay Medicare. And a lot of people do that because a lot of people are continuing to work. But if you don't have that active group plan with 20 or more employees at your company, you're staring at some pretty stiff lifetime late penalties. And the penalty is actually 10% every year that you're out, and it's 10% of the Part B premium. That's B as in Bravo. That's the medical insurance, and that has a premium this year of $202.90. So what would happen if you incurred that lifetime late penalty? Medicare would just add $20, 10% of $200. They would just add that to your Medicare bill each and every month. So if you're out for 2 years, you can double that. They're going to add $40 a month. So the moral of the story here is just don't be late to the party. Be on time or have creditable coverage. And then lastly, the last mistake that people make is not enrolling in a Medigap plan when you're first eligible for Medicare. And Medicare gives everybody coming into Medicare, whether you're age 65 or age 70, when you first start your Part B medical insurance, that's B as in Bravo, you get a 6-month window to enroll in a Medigap plan. And the reason why that's important is if you have a chronic condition, it doesn't matter what it is. It can be kidney disease, liver disease, cardiovascular disease, cancer, any dementia. If you go past that initial 6-month window when it's guaranteed issue and they don't ask any health questions, if you go by 1 day, 6 months and 1 day, and you want to get a Medigap plan, then you have to go through underwriting, and that's the only time in Medicare they can deny you coverage is if you're beyond your initial window. And there's another thing that Medicare offers. You can start your Medicare if you start with a Medicare Advantage, HMO, or a PPO. Then that 6-month window gets extended out to 12 months. That's actually called the 12-month trial period. So Medicare wants you to try these plans. They're really good plans. They have good benefits. The costs are good for an HMO or PPO. But if you can go up to 12 months, and if you don't like the plan for any reason, in the first 12 months, you can call me and I can change it to a Medigap plan with no health history questions asked. But same criteria. If you go 12 months and 1 day and you want to get a Medigap plan, you have to go through underwriting. And I've insured people that have been underwritten that had high blood pressure meds or cholesterol meds, but they didn't have any chronic conditions that are going to cost the insurance company a lot of money and that would cause them to say, no, thanks, we don't want to insure you. So those are your top 3 mistakes that people make in Medicare. And this is a quick review on where your costs are going to come from in Medicare. And this is actually true for just about any health insurance. The premium is the dollar amount that you pay monthly to the plan, to the insurance company to have the insurance. The deductible is the same across all plans. It's the dollar amount that you pay to the insurance company before the insurance kicks in and starts working. And then the copay and the coinsurance is expressed either in a dollar amount or a percentage. And those are ongoing costs until you hit the max out-of-pocket number that every Medicare plan has. So, and this is something important to know. Every Medicare plan that exists, even the drug plans, have what we call a MOOP. And MOOP stands for max out-of-pocket. And it's a dollar amount attached to that plan. And it's not a deductible. It's just a sum total of what you've spent through the calendar year. And when you cross that threshold, then all of your cost, all your Part A hospital cost and Part B medical cost go to zero for the remainder of the year. And that's true with the drug plans as well. So, and we'll get into that in a little bit more. But here's the nuts and bolts. These are the four main parts of Medicare. Part A hospital is for inpatient hospital. If you're admitted to the hospital for 3 days or longer, that's considered a Part A event, and the hospital would actually bill your plan under Part A. Part B medical insurance is what you'll use the most. It's all the outpatient services like doctor visits and lab work and that sort of thing. And A and B is often referred to as original Medicare because it's been around since Lyndon Johnson signed it into law back in 1965. So that's A and B. And then we have Part C, which are all of the Advantage HMOs and PPOs nationwide. So if you ever hear anybody talking about Part C or HMO or PPO or an Advantage plan, it's always an HMO or a PPO in Medicare. And what those plans do is they bundle in Part A, Part B, and Part D, just like any HMO or PPO that you've ever had in the past. It's structured exactly the same with two big exceptions. It usually costs you less and you get more benefits. So the Part D part of Medicare, we're going to go into detail on that in a few slides, but that's where you get your prescription drug coverage in Medicare. And I wanted to touch on the IRMA charges. IRMA is an acronym that stands for Income Related Monthly Adjustment Amount. And it's Medicare's polite way of saying that if you make more money based on these income brackets, they're going to charge you more money for your Part B medical insurance and also for Part D. They add on an IRMA penalty to your Part D portion of that as well. And the middle column shows the income brackets. And what Social Security does when you go to sign up for Medicare is they do a 2-year look back at your tax return. So this year, they're going to be looking at your 2024 tax return. And based on that modified adjusted gross amount, that will determine how much you're going to pay to Medicare for your Part B medical insurance. So this is the bad news. If you make an elevated income based on a single or a joint tax return, you can see how much you're going to be paying to Medicare. The good news is when you retire, Medicare and Social Security both know that most people's income drops pretty significantly. So there's a form, we just call it the IRMA form. I can send that to you, and I think Blake and Jim had that as well. But you can call on me for that. I can email it to you. You basically, it takes about 5 or 10 minutes to fill it out, and you estimate what your new income is going to be in the upcoming 12 months, and then they base your new premium off of that. So I've actually had people that have been 3 or 4 brackets up, and they've been dropped all the way back down to the minimum premium of $202.90 this year. So that's the IRMA, and that's sometimes I forget to tell people this, and they get their first Medicare bill. And by the way, when you sign up for Medicare, they're going to mail you a paper bill, and their default billing is quarterly. And the way you can change that is when you get your Medicare number, you can go to medicare.gov. That's the official website. You can create an account and log on and put your bill on autopay. I highly recommend that you put any and all bills. You can only get 3 bills. Put them all on autopay and forget about them, because if you get kicked out of Medicare for Part B due to non-payment, it's not pretty. It's they don't let you back in until January 1st of the following year, so you would incur lifetime late penalties. It's very wise if you autopay any of your bills, include your Medicare bills with that as well. And if you need this chart, let me know. You can get in touch with me, and I can email this over to you, as well as the Part D portion. And the Part D portion for the IRMA charge ranges in the second bracket here from $15 a month. And if you go all the way up to the top bracket, if you're grossing $500,000 or $750,000 as a joint return, it goes up to $91. So a lot less than the IRMA charges that you see here. But the bad thing about it is, the good thing about it is you can get it reduced when your income drops. So getting into the different parts. So Part A is inpatient hospital insurance, It is premium free for most people as long as you have that 10-year or that 40-quarter work history that they talk about, and you pay deductions, payroll deductions for Social Security and Medicare. Part A, you can never be denied coverage for Part A. It's completely portable. You can take it with you wherever you go in the United States, and it works just as well as it does at home. And that includes most U.S. territories as well, like Puerto Rico, Virgin Islands, Guam, places like that. Um, and the last bullet point is not really relevant, but I wanted to disclose it because there is a deductible for Part A of $1,736. So if you're admitted in a hospital as an inpatient, that deductible is 1736, and that's not an annual deductible. It's the only deductible in Medicare that's not an annual deductible. It can happen multiple times a year, and here's how that works. So if you go in the hospital and you're in there for 3 days or longer, you're eventually discharged. If you stay out of the hospital for 60 consecutive days, that ends that benefit period. If you go back in 61 days or longer, that starts a new benefit period and you get charged that deductible again. So you could actually be charged that deductible multiple times a year. But it doesn't really pertain if you have an Advantage, HMO, or PPO, because most of them do not charge a health deductible or a medical deductible. Just about all of them do charge a drug deductible, and we'll get into that here momentarily. But and if you have a Medigap plan, it covers everything on the Part A side at 100% from day one. So, but it's nice to know because about 13% of the Medicare population of the 70 million people in Medicare only have Part A and B. And unfortunately, they don't find out till it's too late that that's not a good option. That's just asking for bankruptcy because there's no limit to your out-of-pocket expenses. So Part B medical insurance, similar to Part A, it's outpatient services for things like doctor visits, lab work, and it's what you'll use the most if you go to the doctor. And just like Part A, it's you can't be denied coverage ever, and it is completely portable, just like Part A. There is a monthly premium that's adjusted for income. That's the IRMA charge that I just showed you. So if you have a higher income, you could pay more than the 20290 that 80% of the people in Medicare pay. And there's also a penalty if you're late enrolling in Medicare in Part B only. And if you don't have that group health plan from a company with 20 or more employees and you don't get into Medicare on time, then you're going to incur lifetime late penalty. So, and Medicare doesn't negotiate on that. So you don't want to be late when you're enrolling in Part A or Part B. And we'll go over how to get enrolled here towards the end. Part C are all of the Advantage HMOs and PPOs nationwide. And the one negative about both HMOs and PPOs have provider networks. They have limited networks. HMOs are the smallest networks in Medicare, although some of them are pretty large. But with an HMO, it's structured exactly the same as an HMO outside of Medicare, and you have to get a referral to go see from your primary care doctor to go see a specialist. And that whole process is not as cumbersome as it used to be because of COVID and the advent of telehealth. I started my Medicare 6 years ago with a HMO from Humana, and I got a referral over the phone from my primary care's office without even talking to my doctor. I just talked to the receptionist at the office and told them what I needed, a referral to an ophthalmologist for cataract surgery. And so it's a lot simpler now to get referrals. The nice thing about the HMO plans in Orange County is they have some of the best benefits of any plans in the country. And I know because I do this all over the country. And they also have some of the lowest MOOPs. Remember the max out-of-pocket dollar amount that is attached to these plans. With the HMOs, if you go look at them on Medicare.gov, I think SCAN in Long Beach, SCAN Health Plan, they have a plan that has a MOOP of $199. That is your max out-of-pocket for the year 2026. And most of the plans, the HMO plans, have MOOPs somewhere between that and around $800 to $1,000. If you move over to the PPO side, those MOOPs get up into the thousands of dollars. They can be $6,000 or $7,000 or $8,000. And remember that MOOP is not a deductible. It's just a sum total of what you've paid out of pocket throughout the year. So the nice thing also about the HMOs and some of the PPOs is they offer a lot of the extra benefits that you just don't get outside of Medicare, and that's what makes them really attractive. So a lot of those benefits in the last, when I started 9 years ago, they just every year they added more and more benefits and they added more allowances. That trend has reversed as of 2 years ago after COVID ended, and during the open enrollment season in the fall, a lot of companies, a lot of Medicare companies started cutting back on benefits, and they stopped expanding them and they started going the other way because the reimbursement to Medicare insurance companies actually started dropping a couple of years ago. It dropped again last year, and it's going to drop a little bit more next year. So most of the insurance companies in Medicare are publicly traded companies, so they have to report to shareholders, and they're in it for the bottom line for the most part. There's a couple of nonprofits in Medicare, and Scan Health Plan in Long Beach is one of those nonprofits. They actually expanded their benefits the last couple of years. So more power to them. So that's Part C, all the HMOs and PPOs in Medicare, and there's lots to choose from. In Orange County alone, there are 68 plans to choose from about 20 or 25 companies. And so let's take a look at Part D. So this is the Part D drug coverage. There's a couple of ways to get that. You can get it when the Part D drug coverage is bundled into an HMO or PPO, just like a HMO or PPO you have now. You have hospital coverage, doctor coverage, and you have drug coverage bundled into that plan. So, and you can get it with a standalone drug plan. If you decide to go with option number 3, which is a Medigap plan, those don't have drug coverage any longer. So you have to enroll, or I will enroll you in a standalone drug plan, of which there are 12 drug plans to choose from this year in California. And the monthly premiums of those 12 drug plans range from zero, from a plan called Health Spring Assurance. They don't charge any monthly premium. And then the highest plan on the list is from Blue Shield of California. They took honors again this year with the most expensive drug plan in California, and I think it's the most expensive drug plan in the country. They have the monthly premium is $228 just for a drug plan. And every now and then, the way you find out which drug plan is best for you and that has the lowest overall cost based on the monthly premium, the cost of the meds, and the deductible is what I do is I will get your meds and I'll run them through the Medicare website. And anybody can do this. You don't need a login. You can run your meds through. You pick a few pharmacies and you put in your zip, and Medicare brings up that list of 12 drug plans, and their default sort is the lowest overall cost plan right at the top of the list. So it's a no-brainer. It just takes all the guesswork out of it. So, and those drug plans and all Medicare plans are good for the calendar year from January 1 to December 31st. And then in the fall, we have the massive open enrollment period, which is designed specifically for Part D drug plans, for HMOs and PPOs, because those 3 components of Medicare can and will change on an annual basis. Sometimes they change for the good, where they were in that mode of adding a lot of benefits and expanding plans. Now we're going the other way. We're kind of downsizing a little bit in Medicare. But all in all, with 68 plans to choose from and 12 drug plans to choose from, there's plenty of choices out there. And there's not really a lot of bad choices in Medicare. There's a few companies that I choose not to do business with because their customer service is not really that good. But with looking at the Part D, the last 2 points on here, the monthly premium is adjusted for that IRMA charge. So if you have a higher income, you will notice on your Medicare bill when you get it from Medicare, if you have an IRMA charge, it'll show a line item for the Part B IRMA charge and the Part D drug plan IRMA charge right on your Medicare bill. And same as Part C, there's a premium penalty if you enroll late in Part D, and you can do that right from the get-go if you don't have creditable drug coverage. Most plans from most insurance or from most company plans are credible drug coverage, so that allows you to delay Part D as well. But there is a late penalty, and it ranges anywhere from $15 a month up to $91 a month if you're in the top IRMA bracket, earning $500,000. If your adjusted gross was $500,000 a year. So that's everything, almost everything about Part D. A lot of the drug plans will use these three coverage rules, and this typically applies to expensive brand name medications. So if your doctor prescribes you a medication and it's very expensive, they might require prior authorization from the drug plan first. Quantity limits are just that. They will usually limit you to a 30 or a 90-day supply and no more than that. But sometimes they'll make an exception if you know you're going to go on an extended vacation for longer than 90 days. You can request that they fill a 120-day or longer, 150-day fill for your extended vacation. And then step therapy is if a doctor prescribes an expensive medication, the plan may require you to try a generic if there's one available first. And most doctors are familiar with this, and they might even try you on the generic first and then step you up to the brand name medication that costs a lot of money. But all they're trying to do basically is save money. So if a generic works, they might have you stick with that. But so that's it for drug plans. Now we're going to jump over to the Medigap plans. And I'm not going to go into a lot of detail on this chart, but what I wanted to show you across the top are the 10 different Medigap plans that are offered in Medicare. The only one left that gives you 100% coverage that most people are qualified for is Plan G as in golf. This is what I have for my personal insurance. And the only cost that Plan G does not cover is the Part B medical deductible, which is $283 this year. So that is your MOOP. That is your max out of pocket with a Medigap Plan G. And here's exactly how the Plan G works. When you have a Plan G, that is nothing more than an extra insurance policy that attaches to original Medicare Part A and B. So that is your primary insurance. Medicare is your primary insurer. So when you go to the doctor and you show them your red, white, and blue Medicare card, they will immediately ask you, do you have secondary insurance? And that's the Plan G. And it can be from numerous companies. I typically only stick with the biggest of the big companies in Medicare when it comes to the Plan G, because I want financial stability and I don't want huge price increases, more so than the average year over year. And that's what the big companies offer us, like United and Humana and Blue Shield of California, Aetna, those companies. So the Plan G, when you go to the doctor and they perform a service, they bill Medicare. Medicare promptly pays their 80% share of that bill. And then Medicare looks to see if you've met that $283 deductible. And when Medicare has billed you for $283 in approved services, they start sending your 20% share of the bill to the Medigap insurance company, whoever that is. That company cannot question the claim. They can't deny the claim. They're only there to pay your share of the bill after you meet your deductible. And it's as simple as that. That's how the Medigap plans work. So, here is a slide that actually shows the costs in Medicare on both the Part A side and the Part B side. On the Part A hospital side, there's that $1,736 deductible I was talking about. And then beyond that, you have a daily copay. And the Plan G covers all of those costs from day one. So you're not responsible for that deductible. The only deductible you're responsible for, and your only out-of-pocket cost with every Plan G in the United States, is the Part B deductible of $283. That's it. That's all you pay out of pocket with a Plan G. And the coinsurance and the excess charge is, you will probably never see that, but about 5% of doctors in the United States, they take Medicare insurance, but they don't accept Medicare's assigned rates. So they don't accept that assignment. And when they do that, they can legally add 15% to any and every bill. And in 9 years of doing this, I've never had anybody get an excess charge. most doctors just don't bother with it because it's just extra work for them to do that billing. So those are your gaps, the gaps in Medicare that are going to cost you money. And with the Medigap plan, your MOOP or your max out of pocket with a Plan G is $283 in 2026. So these are the top 7 reasons I came up with that why people buy Medigap plans over a PPO or an HMO. And the first 2 points here also pertain to HMOs and PPOs because they are guaranteed issue. You can never be denied coverage with a Medicare HMO or PPO. And you know that you're going to have a limited out-of-pocket expense with all plans in Medicare. The Plan G and your original Medicare A and B are completely portable. I've had lots of people move out of California with a Plan G as far away as Virginia, and they've taken their California Plan G with them, and they kept it because they can. It's portable. You can do that, and U.S. territories as well. And one other thing I wanted to mention about the Plan G. If you travel internationally, it does have a foreign travel component built into it. So it does cover you at 80/20 overseas. So you would want to take your Medicare card and your Plan G card with you if you travel internationally because you do have foreign travel component there. And it acts like regular insurance in that it's 80% covered by the plan. You are responsible for 20%. And it has a $250 deductible per incident. And it has a $50,000 lifetime max. So hopefully you'll never spend $50,000 in a foreign hospital. That wouldn't be a pleasant vacation. But the things about the Plan G, the fact that there's no networks ever, there are no referrals required. And in California and 44 other states, there's no pre-authorizations. That's the big one that most people complain about with an HMO and or a PPO. Even though with a PPO, you can go out of network and you can go to any provider in that network without a referral, pre-authorizations still exist. But here's why I have the asterisk. On January 1st, Medicare started a pilot program. It's called WISER, like a wise owl, WISER. So if you Google Medicare WISER, you can see all the details on it. It's a pilot program that they started in 6 states, and the closest one to us is in Arizona, and then a few states back east. But the program, they identified about 10 billing codes that are subject to abuse and have been abused over the years. So they decided they're going to use AI to determine if these codes, these billing codes for these procedures, should have a pre-authorization. It's a 6-year pilot program. It's going to run through 2031. So nobody but other than these 6 states are going to experience a pre-authorization on just those billing codes. But in California, we're safe. Nevada, we're safe. In 44 states total, there won't be any pre-authorizations at the very earliest until 2031. And again, the thing with a Medigap plan is because the core benefits don't typically change, they may change here in 6 years a little bit, but those benefits, like on a Plan G, which the core benefits are 100% coverage nationwide with any doctor, any hospital that takes Medicare insurance. And Medicare says that's 99% of all providers in the United States take original Medicare insurance. So that plan is guaranteed for life. As long as you pay your monthly premium, they cannot cancel you. They can never cancel you due to health in any Medicare plan for that matter. But one important thing is if you go past your initial period of 6 months or 12 months when you first start your Part B medical insurance and you want to get a Medigap plan beyond that, remember you have to go through underwriting. And if you don't have any chronic conditions, you'll pass underwriting in flying colors. But if you have a chronic conditions, they will probably deny you coverage on a Medigap plan, and you may or may not ever be able to get it. So almost done here, and we'll get into some questions and answers. Anybody can enroll in Medicare as long as you're eligible and you have the credits and the work hours 3 months before your birthday month, and then 3 months after. So Medicare gives you a full 7 months to do this due diligence that we're doing right now. And when we get done, you'll probably have about 3/4 of that done. Um, when I enrolled in Medicare, I purposely enrolled 3 months and 2 weeks outside of my birthday month. My birthday's in August. I enrolled on Easter Sunday in April of 2020, and just to see if the application would get processed, and it did. I logged back in 3 days later, 3 business days later, and my Medicare number was already posted on my Social Security account. So there's a couple of ways to enroll in Medicare. You can go to ssa.gov down here at the bottom, and you can enroll online. That is the quickest, easiest way to do it. It'll take you about 10 or 15 minutes to complete that application. And the same thing for Social Security benefits, too. For the most part, it only takes you about 10 or 15 minutes. I was pleasantly surprised when I started my Social Security benefits. But you can start it online. You will have a benefit verification letter mailed to you from Social Security confirming your benefits and when your plan start date is. And by the way, Medicare always starts on the first calendar day of your birthday month. It doesn't start on your birthday. It's always the very first calendar day of the month. And unless you decide to delay it and start it at a later date. So that's it for enrolling. If you have questions about that, let me know. The very next slide has absolutely nothing to do with Medicare, but it's a very good reason to spend some of your retirement money before you retire. Because when you retire, you're probably going to be like these people from Leisure World, and they're just going to waste a lot of the vacation sleeping. So, I love the smirk on that gondola captain's face there. So that's all I have for now. So let's do questions and answers. Blake, can you see the chat box do we have any questions to go?
Yeah, I'll monitor it. I don't see any messages in the chat function right now. So while we're waiting on that, I do have a question for you. So it seems
Okay.
like based on what you were laying out in the presentation, Medigap seems superior to Advantage at this point since they're reducing some of the benefits. Could you speak
Uh,
to some of the reasons why someone would go Advantage over Medigap?
Mostly budgetary. So the people everybody wants a Medigap plan because there is no better insurance. So I've had people get enrolled in it, and they love the sound of it. They get into it. I'll never forget. I enrolled a lady when I first started. She got into a Medigap plan, and about 3 months later, she called me up and she said, "Bob, I can't afford this." And I said, "I totally understand," and I thanked her for calling me, and I put her in an HMO. I think I put her in an HMO or a PPO because most of those plans don't have monthly premium, so you save that Medigap premium right off the bat. But typically, somebody does not enroll in a Medigap plan just from budgetary purposes. Everybody wants it because there is no better insurance in the United States than a Medigap plan, and a lot of people don't realize that until they have to use it. I get this all the time from healthy 65-year-olds, healthy 70-year-olds. They say, "Bob, why do I want to spend a couple of $100 extra per month when I'm healthy? I don't take any meds. I don't drink. I don't smoke. I don't even go to the doctor for a physical," which is not very smart. But and I tell them, well, I'm a perfect example of that. I do all that stuff. I've been a gym rat my whole life. I've always worked out. I eat healthy. I don't drink. I don't smoke. And I got throat cancer about 4 years ago, just out of the blue. I had a big lump in my throat. This was just at the end of COVID or right during COVID. So I went and got a test, and they said, "No, it's not COVID. Go to an ear, nose, throat." And I did that, and the oncologist looked down my throat. He said, "You got a little black spot on your left tonsil. Go get it biopsied." And sure enough, it was cancer. So I immediately jumped into chemo and radiation, and I had a plan G. Thank God, knock on wood. Not that the HMO that I had would have worked just as fine, but I literally had tens of thousands of dollars in cancer bills, oncology bills, chemo, radiation, all that stuff. And I paid a total, I think it was the Part B deductible then was $233. That's all I paid the whole year for all those bills. And so it works exactly as it's designed to. So typically most people don't get a Medigap plan if it's just not in their budget. And that's one thing I like to qualify people with. So, and I'll give you all the costs of the plans, and most of the HMOs and PPOs don't have a monthly premium. So all you're going to pay to Medicare is that Part B premium. And if you're like 80% of the people in Medicare, you're going to pay the minimum $202.90, call it $203. That's all you're going to pay to Medicare to have a really nice HMO or a PPO. But if you want to step up, the Medigap plan, any Medigap plan G, they're all exactly the same, regardless of who or where you buy it from in the United States. They're all standardized by Medicare, so they offer the exact same benefits. The only thing that's different is a couple of companies have added some extra benefits. Like the bigger companies added free gym memberships back in January 2020 when Medicare allowed them to add some extra benefits to the Medigap plans. They said you can do that. You can add gym memberships. You can add vision, hearing, acupuncture, that kind of stuff. Only one company really did that. That was Blue Shield. All the big ones added free gym memberships. And that's nice if you like to work out because you can go join as many gyms as you like for free. So actually, that was one of the benefits. I forget who it was. It might have been Aetna. They cut back on gym membership. Don't quote me on that, but one of them even cut the gym memberships out, which I think that's kind of ridiculous because the healthier you are, the more profitable you are to an insurance company. But to answer your question, Blake, everybody would like to get a Medigap plan, and you have a limited time that you can get it with no questions asked. But if you're healthy, it's insurance 101. You can't wait till something happens and then go get the insurance. And that's true with a Medigap plan too. You have to get it in a certain period of time where it's guaranteed issue and they're not going to ask you any health history questions. Oh, does that make sense?
Got it. Yeah, that makes sense. And we do have a couple questions that came in, but just a quick follow-up on that. When you're talking about costs, is that monthly premiums and what's kind of the average, I guess, monthly premium cost?
For a plan G, is that what you're asking?
Yeah, for a Medigap, because you said the
Yeah,
costs are a lot.
so Medigap plans right now today will start at around $210 a month. Some of them might be $195, $190, but right around $200, give or take a few dollars. And it goes up every year, just like everything in any health insurance. So this last year, I started with probably 4 years ago with a Blue Shield Plan G, Blue Shield of California. And then when I moved to Nevada, well, let me back up just a little bit. So California created a law back in, it was about 8 or 9 years ago. And that law says if you have a Medigap plan in California, any of those 10 Medigap plans, you can change that plan any year during your birthday month because there is no big open enrollment, national open enrollment time for Medigap plans because they don't change. They stay the same. Remember, the benefits are set in law by Congress. They're trying to change. They may change that those plans in those 6 states or maybe all the states for those 10 billing codes. But for the most part, they don't change. So if you want to change a Medigap plan, and I have people do this every so often, where one company's price might get out of whack with the other ones. And if we know one is cheaper, like United might be cheaper than Anthem or Blue Shield might be cheaper than everybody, you can change to that plan during your birthday month with no health history questions asked. It's just a lateral change. The way the law states is you can change to an equal plan or less. There's really only one plan that's less than a plan G. That is a plan N. I have a handful of people in a plan N, as in November. That one doesn't give you a full 100% coverage like a plan G does, and it has more out-of-pocket costs. Like it has a emergency room copay. It has that 15% excess charge. It doesn't cover that. So there's a couple of extra copays with the plan N, and it's only about $30 less per month. So, and then there's some companies, not many of them, offer a high deductible plan G where it has a $2,800 annual deductible. And the premium is usually less than $100 a month for those plans. But that one deductible, hopefully if you have that deductible, that's going to wipe out your savings for the year for that. But hopefully you're not going to have that deductible year in and year out. So that's another alternative too, is a high deductible plan G. But most people go, the plan G nationwide is the most popular Medigap plan, and that's where all new money is going. There is a plan F, as in Fox, you may have heard about. Medicare all but closed that in January 2020. because they determined that a lot of people that had Plan F were doing what they called Medigap abuse. Plan F covers you at 100% from day one. You don't even have to pay that $283 deductible that a Plan G charges you. So a lot of people that had a Plan F would go to the doctor for just very frivolous reasons. They even determined that there were some shut-ins, just elderly people that lived alone. They would go to the doctor just to have somebody to talk to because it was free. So in January 2020, Medicare said, we're closing the Plan Fs to anybody born before 1955. I was born in 55, so I couldn't get a Plan F, but I wouldn't get it anyway because the premiums were so much higher than a Plan G. It made no economic sense to get a Plan F any longer. As a matter of fact, I love coming across people that have a Plan F, and my first question to them is, you're really overpaying for your Medigap plan when they can in California, they can change that Plan F and drop down to a Plan G, and their only out-of-pocket cost is a $283 deductible. And I can show them in the numbers where it pencils out, it's well worth to pay that $283 deductible and get rid of the Plan F and go with a Plan G. That's the only difference between those two plans. So
awesome. Awesome. Well, we got some questions. I want to make sure we get them all answered.
Okay.
So our first one that came in here, I'm going to read this out loud. Let me know if you need me to repeat it. So
okay.
My wife is 1 year younger than me. How do we enroll me in my 65 year, and what happens to her for that year when she's still 64?
That's a great question. So anybody can enroll 90 days before their 65th birthday month. And you can go to that link. Where was it here? SSA.gov. That'll get you there. But so no problems there. So what spouses typically do is, I have a colleague in Huntington Beach, and he specializes in covered California. And even without the subsidies that didn't renew for 2026, that's what a lot of people go to as a stopgap. So they'll get covered California for a year, 2, 3 years, or whatever. And then when they approach Medicare, we enroll them in one of the Medicare plans. So that's covered California is good because it's you get the group insurance pricing versus if you went direct to an insurance company by yourself, just say, hey, give me a quote for me individually. That's going to be the highest premiums that you'll pay anywhere, anytime. So covered California is probably a good alternative still, even without the subsidies for a spouse that's not 65 yet.
Perfect. Okay, next question. I plan to work until I'm 70 at a company that has an acceptable health plan. Do all the Medicare rules still apply for registering?
Well, if you're saying, a lot of people think that you have to register and get into Medicare at 65, and you don't. Remember, if your company has 20 or more employees, keep your health plan, especially if it has an HSA and you have a high deductible plan and you're contributing to a health savings account. That's one of the best tax advantages left. But you can keep delaying Part A and Part B up until age 70 or when you retire. My record is 81 years old. I have a guy that was self-employed, and his company paid his and his family's insurance premiums, and he didn't retire until he sold his company till he was 81. And people said, is this right? An 81-year-old just coming into Medicare. But anyway, so yeah, you can delay it till age 70. You would probably want to get in Medicare then, as well as Social Security. And there's actually, I think now on SSA.gov, there's one application. When you hit 70, you can fill out one app and check a box to enroll you in A and B. So you don't have to fill out two separate applications. So that's a good strategy because you're going to maximize your Social Security benefit at age 70, and you can get into Medicare then as well.
But to that point, Bob, there's no drawback to at least applying for Part A because it doesn't cost you anything.
Not at all. And a lot of people do that. So Part A would add an extra layer of hospital insurance to your group plan. So the group plan, as long as you're still active there, that's going to be primary, and then Medicare would be secondary. So they could come in and pay some or all of your share of a hospital bill. So yeah, if you can get into the system, you can actually go on SSA.gov and fill out the application, and you just check the box that says delay Part B. You only want Part A for now, hospital insurance. And then the sign up for Part B as it stands today It's a two-part paper form. One of those forms goes to your HR department, and they attest to the fact, they sign off that you had creditable insurance from a company with 20 or more employees, and you delayed Part B until this date. So you had it from this date to this date, and they sign off on that. Then when you get that back, you fill out the other form, you take them both to Social Security, and they start your Part B. If you want to start it at 70, you write in the date that you want it to start on there.
Awesome. Here's a great question, and I'm sure a lot of other people are thinking about this as well. If I'm already on a Medicare Advantage plan, how do I switch to a Medigap plan if I've been 6 months into the Medicare Advantage plan?
If you're over 6 months, so you have an Advantage plan right now, is that right?
Yes,
Is
the
that what you said?
individual has the Advantage plan, but now they're hearing all the great benefits about the Medigap, so they'd be interested in evaluating switching to the Medigap. But it sounds like they've been on the Advantage for 6 months.
So that's not a problem. If you started that Advantage plan when your A and your B started at 65, then you're into your 12-month trial period. So remember, Medicare gives everybody 12 months to try an Advantage plan. And if at any time in that first 12 months, as long as your A and your B and that Advantage plan all started on the same day, you're in your 12-month trial period. You can call me or anybody for that matter, and you can enroll in a Medigap plan with no questions asked. That's called the 12-month trial period. It's good nationwide. If you waited a little bit and you started A and B and you didn't start or you started the Advantage plan later, there's another law on the books that most people don't know about. It's called the Knox-Keene Act, and that was passed, I think, in 2017. And it says that if you have a Medicare Advantage plan in California, and this is only in California, it's not in any other state, if that plan raised the price of any service within the plan by 15% or more, or if they reduced a service, or if the plan closed, that opens the door to a Medigap plan with no questions asked. So jot my number down right here and call me at your convenience, and we can chat about that. And there's ways to actually get into a Medigap plan if you're beyond that initial guaranteed issue period. But it sounds like you might be in your 12-month trial period, so that might work. And then if that doesn't work, this fall, you're going to get an annual notice of change letter. We call that the ANOC letter. When you get that letter, you're supposed to have it in your hand by the end of September before the open enrollment starts on October 15th. They were kind of late last year, and some of them didn't get their ANOC letter until the first week of October. Read that letter. It will tell you what changes are going to take place in your plan for 2027. And if you see anything in there that says, yeah, this service is going to go up from $10 to $15, you're in. If they say we're going to eliminate these services in the plan, you're in. Or if they close the plan, that all opens the door to what we call a special election period or an SEP. So get in touch with me and we can monitor it. But your job would be to read your annual notice of change letter this September when you get that, and that'll tell you if you're going to be eligible for a Medigap plan.
In that 12-month trial period, are you eligible for that if you delay past 65 since you were on an employer plan with credible coverage? Or is that
Yes.
12-month trial? Okay.
It's when your Part B starts and you start. Some companies are kind of funny. They want A and B and the Medigap plan, or I'm sorry, the Advantage plan to all start on the same day. A lot of people will delay B and they start Part A, and but some companies will base it on your Part B start date. So Part B, that start date starts the 12-month trial period as well. So if you started Part B and you delayed Part A, and at the same time your Part B started, the exact same day, if you started that Advantage plan, you may be eligible for the 12-month trial period. So that's why you may be right in the middle of that 12-month trial period right now, and you've got another 6 months. But if you wanted to get into a Medigap plan and you're in a 12-month trial period, you can make the change today, and it would actually start on Monday, June 1st.
Okay, awesome. And I think this would be good for people to know too. Can you speak to the rules regarding contributing to health savings accounts prior to 65 and what to be aware of, even if your planning on continuing to work past 65 based on those rules?
If you sign up for any part of Medicare, like we were just talking about, if you delay uh, Part B and you go ahead and get in Part A, you cannot make any more HSA contributions. So if you're contributing to an HSA today, do not enroll in any part of Medicare. Keep doing that HSA. Max that out as best you can because there's just no benefit that compares to that. And that money's going to be available to you to spend on things like Medigap premiums for most HSAs. They allow you to spend that for healthcare purposes, and you can use that to pay for your Medigap plan.
Awesome. Awesome. Well, we got a couple minutes left. If anyone has any final questions, but just kind of as a friendly reminder, so we at Anchor Bay, we specialize in financial planning and investment management and tax, but Bob Bernardo specializes in all things Medicare. So this is his lane, and we've been referring clients to him for a long period of time because we trust him and he knows his stuff, and he takes great care of the clients that we work with. So his information's on the screen if you ever need a second perspective, even if you're on Medicare already and you want to see if it makes sense to pivot to another type of plan. He's a great resource that we certainly can attest
And
to.
the best thing about my services is they're completely free. Medicare forbids anybody, any agent, any agency or call center, they forbid anybody to charge you any money for Medicare advice. So if anybody ever says, "Oh yeah, I have to bill you $100 for this Medicare advice," hang up and walk away or go somewhere else because it's always free. We get paid a commission by whatever insurance company you enroll with, and that's why I'm contracted with so many companies. I decided early on I'm going to become a subject matter expert in Medicare, and I've accomplished that. And that's why I'm contracted with so many insurance companies. So I have it. If it's available in Medicare, I have it, and it's not going to cost you a penny.
Awesome. Any final, I guess, pieces of advice, Bob, as it relates to Advantage versus Medigap, or mistakes or things to be thinking about for those that are approaching Medicare? They're 63, 64.
Yeah, the closer you get to age 65, uh, it'll start about 6 to 8 months out before you turn 65. You're going to start getting a mountain of junk mail from everybody, companies you've never even heard of before. A lot of those mailers and a lot of the ads that you see on TV, especially around open enrollment, they're not insurance companies. They're not agencies like myself. They're marketing companies. And all they're trying to do is capture your contact information, your phone number and your address and your email. And they sell that to the 10,000 plus Medicare agents across the country. So be wary. If you ever call an ad on TV, they will call you till the day you die. They have your phone number. Otherwise, they don't have your phone number if you don't call them. So Medicare forbids that. Medicare forbids cold calling. By Medicare rules, I can't call any of you. You can call me, and that opens the door. Then we can have a two-way conversation anytime, anywhere. But just be leery. Don't answer any ads or don't call any mailers unless it's maybe an insurance company. But again, I'm licensed with just about all the major insurance companies. So if you want to know about a particular plan, call me. It's not going to cost you anything, and that's what I'm here for. So that's all I do is Medicare, day in and day out. And so I'm here to help you get where you need to go. If you're turning 65 or if you already have a plan and you want to shop it and see if there's a lower priced Medigap plan or a better HMO or a better PPO, that's what I do.
Absolutely. Yeah, we're happy to get you all in touch with him as well in case you didn't jot down the contact information. But we're coming up on the top of the hour here, so I'll just close it out. Thank you so much, everyone, for attending. Like I said, this has been recorded. We'll get it posted soon in case you want to rewatch it, but tons of valuable information. Thank you, Bob, and thank you all for attending, and hope you have a great rest of your evening.
One last thing before everybody goes. That Social Security number at the top of the screen, I put it up there so you can memorize it to never call it. That is their call center. If you call that number 772-1213, you will literally sit on hold for 2 to 3 hours. Now, that being said, Social Security and Medicare, they're going to be changing their phone system sometime in the future, and they're going to get in the 21st century finally. So if you call that number, it'll route to an office, and they have hundreds of offices across the country. So it'll route to an office that's not busy. But if you call it right now today, even right now, well, they're closed now. They're only open from 9 to 4. But I have a list, and it's actually on my website, of every Social Security office in the country, and it has their local phone number. And they're all mostly toll-free numbers, even though it goes right into that office. So that's who you want to call when you have a question about Social Security. If it's about Medicare, call me. And then the Medicare number is good. You can't forget that one, 1-800-Medicare. You can call them 24 hours a day. But Social Security is kind of sticky there. So don't call 772-1213. If you need the local office phone number, just call me and I'll email it or text it to you. So
Perfect.
yeah.
Well, that's a great way to end it. Thanks, everyone. Take care
Thank
now.
you very much.